dental journey in implantology. I'm here with John Minichetti, the implant daddy.
Thank you for having me.
Oh, it's a pleasure to have you here. And there's many questions that patients do on social media that they tell us about this and that and things around the implant world.
For sure.
That I would like to discuss with you. Is
My
that okay
pleasure.
with you?
I'm here. Let's do it.
Let's go. So, question one. How has technology for individual dental implants evolved in recent years? What can you say about that?
Oh, the technology is exploding in implant dentistry. I've been doing implant dentistry over 40 years, and boy, has the technology changed. You know, computers.
Yes.
And artificial intelligence and all our advances in the technology has helped make these procedures simpler and more routine. Think of how many people are receiving implants today versus
How many
20,
you think?
30. Oh, how many do you think? Well,
implants only in America?
In America, there's probably 100 million people that are without some teeth. I mean, that's a lot of people without missing one or more teeth. That's a lot of implants.
So there's thousands of implants that have been placed all over America.
Absolutely.
Every day.
Increasing every year.
Whoa.
Yep, increasing every year. And the computers, the diagnosis, the radiography. We're doing CAT scans in the office. We're taking digital x-rays and within seconds. The diagnosis is so much quicker. The planning is so much easier. The fabrication. You can leave an office with a tooth that day. Think about that. That was inconceivable years ago.
I know. It's great.
Yes.
And that's one of the things about patients asking, like, who do I'm going to choose to do my implants? So that's something that we're going to talk about later on.
Very important.
The next question would be, what are the key considerations for choosing between an individual implant or other options for oral rehabilitation? What can you say about it?
Well, I mean, you should go first to a clinician who can diagnose both. You don't want someone who only does implants. He should be able to recommend regular treatment or bridge work, because sometimes that's indicated too.
Yeah.
But one of the things you don't want to do is you don't want to do destructive dentistry anymore. You don't want to grind down healthy teeth. So the old technology of grinding down healthy teeth to make a bridge or a denture, that's things of the past.
But what happens with many doctors, which they do amazing work, and they haven't been through implantology? I mean, they know that it's out there, but they're doing general dentistry.
Right.
A patient walks to their office, and they say, hey, the best thing to do is a partial. Or the best thing to do is, like, let's grind down 2 more teeth so you can do a 3-unit bridge.
Right.
What's going to happen with that? I mean, because...
That's the sad part of that. You want to make sure that you go to a recognized doctor or a doctor who's educated and well-versed in all of the technology available, so you can have all the options and all the advantages and disadvantages between those options.
So you think it's a must that all doctors should know about implant dentistry?
Absolutely. You have to have implant education and knowledge, even if they're not performing those procedures.
Okay, so they should go to
so they can know when to recommend.
Absolutely. Any course, like probably a weekend course, just to know.
Absolutely.
And then they can say, okay, I'm not going to do it, but I need to know and I need to inform my patients about it.
Yeah, and some of the doctors can go to even longer courses. We have our American Academy of Implant Dentistry, who I'm one of the past presidents of. It's been in existence. It's the oldest organization in implant dentistry, over 70 years in the United States. We run maxi courses, which are year-long educational programs. Even if someone comes out of that course and never does the surgery, they have such diagnostic skills. Many of them have told us that they've learned more in 1 year than they did in 4 years of dental school.
Ooh. Well, that's great. And now, this is more about doctors.
Yes.
But we want to talk a little bit more about patients.
Yes.
About the age, about the general health, because that's the next question.
Yes.
About the impact, the viability, and individual dental implants. How does that affect?
Well, let's start with that. Age is not a factor with implants. As long as you're a healthy patient for minor surgical procedures, you can have these procedures done.
So everyone can have it?
Correct. We've done patients aging from 17 or missing teeth. Maybe they just by birth they didn't get it, or orthodontically their teeth weren't in the right position, or the elderly who are 90s and they want to stabilize a denture. So these are all candidates for implant dentistry.
You can make them eat again.
Absolutely.
And forget about dentures, because we are like in the middle of a moment where they used to have dentures.
That's right.
And they love dentures, and they are living with dentures for 30 years.
Yes.
And then you tell them, hey, dentures are not a good idea. You need to go for implants. It's like a shocking thing.
Correct.
Because probably the denturist is going to say, well, why implants? If they're talking and eating like good, why do they need
Well, sometimes it's an adjunct. Maybe it's an in-between. I mean, I have a recent story. I have one of the chief surgeons at my local hospital's mother. She's 92. She's been wearing dentures for probably over 30 years.
Okay.
And the dentures weren't functioning anymore for her.
Okay.
So a simple solution, we added a few implants and snapped in her denture. Now she's eating. And that's for her health. It wasn't for aesthetics. It wasn't because she wanted to look better.
Function.
And her daughter's ecstatic because she's going to be healthier.
I know. That's fantastic. And that's thank God we have that.
Because
this is the first moment in human being that we can have that.
Correct.
So this is interesting. Now, next question. It says, what is the latest research on the durability and long-term success of individual dental implants that you know, that you have like
Well, there's studies out there, 10, 15, 20-year studies on the success rates of dental implants. And most of the statistics shows that these are viable treatment options.
Whoa.
You know?
Well, that's
success
really good.
rates in the 90 percentile, minimal complications. Of course, anything can have a complication, such as having hip surgery, back surgery, etc. But they're minimal, and a lot of those complications can be overcome by retreatment or redoing procedures.
Well, that's good. Next question is going to be, how do multiple implants address the challenges of larger dental spaces?
Well, larger dental space, when you have a big space, what are we talking about? What's a dental space? You have a lot of teeth missing.
Okay.
You can't make a bridge. It's like having the George Washington Bridge too long. It's too long of a span to support the trucks.
Gotcha.
We have to put new beams in between, and those are what the dental implants function as. They support teeth for bridge work.
10, 20? How many would you think?
You know, there's no absolute, because you hear a lot of the research and support. You hear the all on 4.
Yeah.
You know, that's kind of like a minimum of an all on 4.
Gotcha.
But of course, if you have room for a few more implants, usually for a full arch or like an upper or lower fixed or permanent tooth replacement, we recommend 4 or more.
Yes.
Yeah.
Good.
Yeah.
Well, next question is, we're going to talk a little bit about all-on-4 and all-on-6.
Cool.
How has the all-on-4 and the all-on-6 influenced the perspective of complete oral rehab?
It's changed it a lot because for many years we were salvaging teeth that were compromised because we didn't want to put so many implants in between or into a patient, or we were trying to keep fees to a minimum. But now with the latest technology, we can place implants where we have enough bone. We can re-angle the connections to those implants, which we couldn't do years ago. We could fabricate the bridge work much more easily than we could do several years ago. And now we can offer these full arch rehabilitative procedures for actually less than we did years ago.
So that could be it's something of the next question. What could be the main benefits and challenges?
Some of the main benefits are that you now have fixed, when you're talking about all-on-4 technique or something similar to that, a fixed arch. It's a permanent solution. It's stable. It feels more like your own teeth. It looks good. It's easy to clean. They feel natural. You can bite into just about anything you want to and not worry about sores on your gums as you did with dentures.
And the difference is going to be how much bone you have.
Correct.
For the all-on-6 or the all-on-4.
Absolutely.
And then the next question is about the 3-on-6 technique. Consider appropriate, and how does it differ from the other options? What could be your point of view about that?
Well, it depends. I mean, you don't want to have the minimum amount of implants that if you have a failure or complication, you don't have a backup. So if you have more implants to support your prosthesis, it is better.
Exactly. Now, the next question is going to be, what role does the quantity of implants play in the 3-on-6 technique in terms of stability and aesthetics results?
Well, the more implants you have, the more stable the bridge work's going to be, the less load or function or more support for function you're going to have, less bone remodeling over time. Because what we find can happen over time is if we put too much stress on too few implants, it can cause the bone to remodel, and then that can sometimes lead to gum disease around implants.
Exactly.
Peri-implantitis.
And also for patients that they don't want to see no gum, and if they are candidates, they can go for the 3-on-6. But what happens if they already have receding gums, they have no bone, so or very small amount of bone, is going to be like an all-on-6 or an all-on-4, rather than a 3-on-6.
Correct.
Okay, and the next question is going to be, are there recent advantages in 3D printing and its application in the manufacturing of implant-supported prostheses?
Well, of course, the 3D printing has changed a lot now. We have the ability to make things in the lab quickly. I mean, printing takes some time, but quickly. And certainly for the provisionals or our smile designs or our acrylic designs or our night guards, this is where all 3D printing comes in. 3D printing we're also utilizing for surgical guides to make the surgery simpler for the surgeons, quicker for the surgeons, quicker for the connections and conversions. Those patients who get the same day procedures, that's where you implement these techniques. So certainly these technologies really revolutionized implant dentistry.
Exactly. What are the most promising technologies expected to implant implantology in the near future?
Yeah. Well, we have a lot of technology right now with computer technology, and I think it's really contributing to the implant designs, implant manufacturing, and restorative, or making crowns and making bridges. I think really the next promising technologies is regenerative. When we get into the regenerating tissues, regenerating bone, regenerating gum, we have materials, but I don't think they're anywhere near what they will be in the future. That is going to be the true future of science.
Exactly.
Of science, replacing true tissue, true bone with what's supposed to be
nanotechnology.
Yeah, I mean, it's going to be unbelievable.
I know.
Yeah.
Next question will be, what are the most important tips for patients to follow for their care and maintenance of their dental implants?
Well, it's like your own teeth. You definitely want to maintain them. You want to have good oral hygiene. Sometimes when people have bridge work or implant work, they need maybe some special brushes or oral irrigation devices. Those are always very useful for those patients. We try to customize the home care for each patient because some patients are a little bit different, manipulating instruments based upon their age, so we'll pick the appropriate things. We have, of course, hygiene specialists who coordinate that, and it's certainly important for the patients to come in routinely to see their doctor or implantologist to monitor and make sure they're doing a good job and appropriately cleaning around these prostheses to make them last the longest they can.
Oof, yes, absolutely. That's a really good one. Now, this is more a little bit about doctors. What is the role of continuous education for dental professionals in preventing and resolving complications?
I think that's important because doctors need to know how to diagnose when it's a complication, not to ignore it or something early. It's much more preventable to treat it. Detecting pockets around implants is very important. Getting in aggressively to begin with to eliminate peri-implantitis or mucositis, and trying to resolve complications before they become severe.
And next question will be, how is a patient evaluated before deciding to the type of dental implant that would best suit their needs?
Well, I mean, number one, photographs, oral examination, and of course, diagnosis. Now we're using CBCT or computer technology to actually look at things three-dimensionally to measure patients for their implant number, implant design, implant position, etc.
How has the perception of quality of life changed for patients after receiving dental implants? In your experience, how many years placing implants you have been doing?
Oh, I've been placing implants for over 35 years. I was placing implants when implants were safe.
Okay. Okay.
It was a whole different world then. Yeah. No, it was great. It's been a wonderful run. So I've seen a tremendous change in technology over the implants, and I've seen a lot of patients' lives change. How? From the person with psychological problems or social problems due to their appearance, not changing their appearance and changing their confidence with dental implants, to patients having more confidence in their career options. I remember, a person of mine, she went from dentures that she couldn't keep in her mouth to permanent bridges, and this was many years ago. She then went to paralegal school, to law school, changed her confidence in her lifestyle.
Just because of implants?
Yes, just because of implants. And then I've had patients who think about it, their life depends upon their teeth. Jazz musicians. In my work with the hospital, we were introduced to a number of musicians who work and live in the New York City area. And some of them, when their teeth were failing, they can't play. You can't play a horn. You can't play a sax. No. You're out of work. You have no money to pay the rent.
Oh my God.
So these are life-changing differences. And I've had people say, you've given me a new life. You give me a second chance on life to earn a living Think about that.
That's why we place implants.
That's why we place implants. We want to change people's lives, and we have. You know, it's something that we can say. You know, in medicine, sometimes we're making lives longer. In dentistry, we're changing lives.
And exactly, we're changing lives. Those are the things that really caught my attention, because it's like, it's a life-changing story.
It is.
And I think it's not in everything in medicine, there's just a few that we can change lives.
I'm sure if
And
your
dentistry,
office is like mine, you have a box of tissues on your desk.
Exactly.
Because sometimes patients, they get so emotional when they talk about this, and so emotional when they're done, because they're so happy with joy.
Exactly.
It's tears of joy.
That's why we do lots of testimonials.
That's for sure.
Exactly. Well, I want to thank you for all the questions that patients have been asking us, and who can be the best to answer those beautiful questions, and the Implant Daddy.
Implant Daddy!
Exactly.
Thank you, Dr.
Thank you, mi
Arzate,
amigo.
for all you do for implant dentistry. Thank you.
It's a privilege to have you here, and thanks for your questions and your answers.
My pleasure.